Welcome, everybody, to Revive Health's Daily Briefing Live for Monday, March 30th. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with the COVID-19 crisis. I am Chris Bevelow, Health Systems Practice Lead at Revive Health, and your host for the show. I am joined, as always, by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show producer. Hello, Chase.
Hey, Chris.
How are you?
Doing well. Happy Monday.
Happy Monday to you. Did you have an okay weekend?
It was good. Yeah, pretty solid.
Good. We're also joined today by Paul Hackett, who's Executive Credit Director at Revive Health. Hello, Paul.
Hello, Chris and Chase. Thanks for having me.
Yeah, thanks for being with us. Real quick, do you have like a 30-second bio of yourself you want to display for us? Tell us where you...
No, I'm kidding. Yeah, so Paul Hackett here, Executive Creative Director at Revive Health. Been with Revive Health for about 3 years now. Spent most of my career, or my entire career, aside from being at Revive Health, in New York City, working at various agencies, mainly in consumer advertising. Started out as a copywriter on MasterCard priceless campaign, and just worked on multiple categories, finally ending up working in healthcare for about the last 4 years. I was in New York before coming to Revive. So copywriter by trade, and happy to be here.
Yeah, great. Thank you for doing that, and welcome. Welcome to the show. So if you haven't joined us before, each show we cover the latest news on COVID-19 as best we can, how it relates to marketing communications in the health system space, try to point out some resources, and really focus on what we're seeing and hearing from our clients and others across the industry. We also want to make this a forum for interaction with folks who are attending live with us. So use the question queue in Zoom, and you can plant your questions in there at any time during the podcast, and we will answer them at the end, as many as we can get to. You can also use the chat function to talk to other attendees. But if you want us to answer a question, make sure you get it in that question queue. Note that Chase will be planting links to websites we reference in the chat function as well, so you can get those right away. Also know that there is a recording of the show that we post every day on our website, which is thinkrevivehealth.com. We have an actual hub for all COVID-related content. That's at thinkrevivehealth.com/COVID-19. Also, we have been accepted by iTunes. So now you can go search for Revive Health Daily Briefing Live on iTunes, subscribe as a podcast, which we know is maybe the easiest way for many of you to listen in, because it's hard. We try to make this easy to be on air at the same time every day, but we know it's a crazy, crazy time. So hopefully this will make it as simple as possible for folks to be able to listen in. I know it's so convenient to have that just load right to your phone, your podcast app, if you're an Apple like me, and listen when you can. So now it's now available. Thank you, Chase, for going through whatever hoops you had to go through.
Yeah, it was actually pretty quick, so not too bad.
Cool. A couple of points to always start out with before we dive in. We are not experts on COVID-19 or coronavirus or medical or scientific personnel of any kind. So not the place to come for any information on that. But we do have opinions on marketing, communications, PR, and all the ways that you might be trying to manage during the COVID-19 crisis. Just keep in mind that whatever we're pulling forward, you need to apply to your current situation, make sure it's relevant and in the right context. As we all are aware, this is different everywhere you're at, depending on the organization you're in and the city you're in, because unfortunately, it is spreading across the country faster than we would have liked. So just take all that into context. So with that, we always start the show with the latest count. The reason we do that is because obviously all the things we talk about are in context of where we're at as a country, and again, where you're at as a market. And as this kind of continues to spike, unfortunately, That shapes everything we think and everything that we do. And then at some point, hopefully sooner rather than later, we'll be on the downswing, which will also change how we think about all of this. So using the Johns Hopkins tool that many of you are aware of, I refreshed right before the show. And the first thing we look at is international cases. We have 745,308 international cases. My guess is we will top 1 million before this week is out. Total deaths, 35,307. And then you look at the United States, and unfortunately, we are really shooting upwards. I think it was, I don't know if it was Thursday or Friday, Chase, where we noted that we had become number one. Now we are just really distancing ourselves from the second, which is Italy. We have 144,672 cases and 2,575 deaths. And as we spoke about Friday, and I'm sure most people are well aware of, we are now seeing significant spikes in metro areas beyond the original of particularly Seattle and New York City. Now we're hearing Detroit, Chicago, Philadelphia, Florida is growing, Atlanta. So, maybe not a surprise, but still very unfortunate and discouraging as we see it spread. So wanted to share that. A couple of resources. First of all, just a reminder, if you haven't reviewed our COVID-19 consumer survey findings report, you can find it at that communication hub that I mentioned before, thinkrevivehealth.com/COVID-19. We are actually, I believe, still on course to rerun the survey tomorrow to see what, if anything, has changed. It's been, by tomorrow or Wednesday, it'll be, I think, almost 2 weeks since we first ran the survey. So we expect some things to change. We just don't know which survey answers and to what degree. So we'll be reporting on the results of that as soon as we get them in. The other thing I wanted to share was an email sent to us by Warren Johnson. So I've known Warren for a long time. He's the Director of Experience Strategy at Mid-Michigan Health. And he wanted to point out how hospitals and health systems are dealing with an increase in community and consumer interest in contributing both money and supplies. So obviously there's been a huge call for help in both areas. So some of it's more explicitly solicited depending on your organization or your city, but obviously also unsolicited. So he points out, I'm going to give you some links here, but you have to figure out how to deal with both of those, right? Because obviously you're going to be getting things that you want, but also you're probably getting things that people think are helpful that aren't helpful. And he points out an example of a lot of the stuff that was sent to Haiti after the earthquake just wasn't super helpful, or other crises like that. So he said, quote, "This is forcing staff to eloquently put parameters around donations and think about the impact of how you're doing that." He gives some links, which Chase will share, for Spectrum Health, Piedmont Healthcare, Trinity of New England, and his own organization, Mid-Michigan Health, as examples of how folks are trying to tackle this. So just another dynamic we haven't really hit on. We may want to dive into deeper later, but I thought that was a really good point to really make sure you're on top of that, particularly obviously if you're soliciting support publicly, but even if it's unsolicited, if you haven't gone out there in a strong way to be proactive about directing people on what you need, how they can contribute, excuse me, how cash donations might be used, that type of thing. So thank you, Warren. Continue to send in the contributions, and other people as well. We're always looking for feedback on what we should be talking about on the show. So really appreciate that. And just a reminder again that if you have questions as we go through, please put them in the question queue. All right, Mr. Paul Hackett.
Yes.
Let's dive in a little bit to what we're seeing from hospitals and health systems. And I know we want to talk specifically about one client that we've worked with, but also just in general, how people are leveraging creativity in this crisis in terms of communication. We've been talking about that since the show started. We believe that there's an opportunity for hospitals and health systems to, of course, be proactive in providing up-to-date, accurate information on what to do during the COVID-19 crisis in terms of everything from if you suspect you have symptoms to washing your hands, but also the opportunity to show up as leaders in the community. So we want to kind of talk through that a little bit. But why don't you talk about your perspective? I know you mentioned before that most of your career is spent in New York City, and you had a reference point we were talking before the show that I thought was pretty cool to bring forward here.
Yeah, for sure, for sure. I was going to jump into some work, but yeah, I mean, obviously, as I mentioned, I spent, I was born in New York City, spent most of my career in New York City. And this reminds me of the time, right after 9/11, when we were celebrating firefighters and first responders and holding them into such high regard. And that really hasn't changed in 19 years. They're still held on this pedestal for what they do, running towards the chaos and catastrophe and putting themselves in risk to save others. And, part of me thinks it is, regardless where you stand on the healthcare debate, the cost, is it the hospitals, or is it the pharma companies, whoever it is, I see this as an opportunity that no one can argue with, Republican or Democrat, that healthcare folks, doctors, nurses, people on the front line, I want to see them hopefully rising and being held on that pedestal like firefighters and first responders. So that's just kind of an overarching thought of where a positive outcome where we could come from this.
Yeah.
And over the past weeks, going back to creativity now, over the past weeks, I've seen how creativity is, it's really working overtime right now to respond to this rapidly changing consumer behavior, the changing circumstances every day, these periods of isolation or job loss, and really using creativity to kind of create a positive environment or really send a powerful and emotional message that really connects with folks. So Chase, I think this is a great opportunity to share that piece I found. I found this piece of communications online. Not sure if it's coming from a health system. Regardless, it doesn't really matter. But there are these images floating around, surfacing online of these healthcare workers with the masks, having worn their masks for God knows how long. And when they take them off, their faces are marked, bruised. From wearing the mask so long. And one agency, I believe it was Saatchi & Saatchi Croatia, that took these images and created a message out of them. Just a powerful message. Stop nonstop domestic violence. Every time you get out of your home, medical staff takes a hit. So again, just a powerful, real, authentic message. And kind of a different way to tell people to stay home. So really.
Yeah, it just invokes what we, most of us have seen, domestic violence, public service announcements, and many times they feature the victims, right? And so this is leveraging something many people are familiar with, triggering that emotion of just so powerful, but also clever, to your point about creativity and non-domestic violence, right? So leaving your home actually causes pain and suffering, and death, unfortunately, for some. So just a really stark way to bring that forward.
Yeah. And I've talked about this, previously in other talks I've given, but I've talked about how other categories would kill for a fraction of the emotional relevance and the humanity that we have in healthcare and healthcare marketing. So really finding ways to to make that emotional connection and really find ways to impact lives and connect with people is a huge opportunity at this moment.
Yeah. So let's switch gears. Let's talk about a client we've worked with, and I'll give this a little bit of setup from a strategic standpoint. So this is the Christ Hospital in Cincinnati, and really forward-thinking group there, and collaborated together again around the idea of, look, can't really have service line marketing messages out right now, having to draw back on elective surgeries. Plus, is it really appropriate? It just feels like everybody's focused on this. Nobody's going to pay attention to that. And they really wanted to come forward and and I could fill a gap. Just, I think a lot of us have felt a gap in terms of leadership. I think actually the political leadership in Ohio has been very forward and progressive on this crisis. So it's not even about that, but it's more just people want support. They want messages, and it can't be pie in the sky. It can't be false hope. We want to be given the truth. I can't remember who said that, if it was Franklin Roosevelt or Harry Truman. Somebody back in World War II said, Americans deserve the truth, give them the truth, they can handle the truth. And so it's got to be realistic. And so we work with them and really around the concept, the strategy of, look, Cincinnati is a close-knit community. So it's a metropolitan area, but still a lot of legacy there, very close-knit. And the sentiment really was, look, if we can come together and support each other, we can get through this together as a community. And that was really the foundation for what they wanted to deliver in terms of a message. They wanted that to come through. And then Paul, I think you can speak to how we went about pulling that forward, particularly given where they were already in the market with their messaging and how we kind of pivoted given the crisis.
Yeah, sure. Chase, maybe you want to bring that work up at this time, we had a current brand campaign out in the market, and focusing on this idea of that moment when, and that moment when your life changes. The Christ Hospital is here for you. There's always these pivotal moments that could affect your life in terms of your health and the health of your family members. So we kind of wanted, it was out in the market. It was a lot of traction. People were familiar with it. So we just wanted to kind of twist it a little bit to kind of keep that same messaging, but really turn it outward, not necessarily about us and how we could help you, but how we could all help each other, as Chris was mentioning. So, really trying to keep the messages simple, but powerful. We started kind of giving out community things people could do within the community. So you see here a series of, ads. They could be billboards, they're social posts, they're really running across the media spectrum. That moment, neighbors, here you go. That moment, community becomes everything is now. Really a message about how we can all help each other in this moment, whether it's a neighbor that, can't go out or shouldn't go out because their health is compromised. How can we help that neighbor by doing whatever it is, running errands for them? So just a big, bold, simple messages and right. Multiple messages that really build consistency and recognition over time. That moment, neighbors become family is now. Just that beautiful picture of two kids staring out the window, maybe kind of waving to their neighbor. Another one, that moment, distance brings us closer is now. Again, really, although we're apart, let's stay connected, and there's ways to stay connected. And another one, really kind of maintaining your personal health. That moment to teach by example is now. Not giving up, but really staying active and healthy. So again, I'm not necessarily talking about ourselves, or not talking about ourselves. Right. We're really talking about all of us and being a leaders in the community and how we can all get through this together, as Chris mentioned.
Yeah, and I think what's important to point out too here is we're looking at what we were seeing there were final versions of comps, and I'm trying to find it, and I don't have it in front of me. All of the stuff out in the market actually has a call to action that drives people in, so they can learn more about how they can help others. So there's a digital component, a hub on their website where there's more that people can do, content for them to learn from, that type of thing. So not just delivering a supportive, encouraging, but yet still realistic message, but also a call to action so that people have a place to go to do more if they want to do more.
And I think, on another point, I think the way Christ is showing up and the way a lot of the way you show up during these times of crisis could really have a lasting impact for years, the way people perceive you. So I think it's important to show up in a truthful, honest, and authentic way during this time. And that's why I want to show both those examples both kind of being honest. One a little more hard hitting, obviously that thing out of Croatia, a little more tough and gritty, but both honest, both not sugarcoating anything, both being truthful.
Yeah, we had, as you know, we had Jen on Friday talking about the importance of tone and visuals and accuracy in visuals and not showing things that are counter to social distancing and the things that we all know are important right now. You know, and having to balance those kind of restrictions is the best way to put it, with the need to go out there and really deliver these messages. So it's not an easy path to navigate, but definitely something you can do to make sure you're still coming forward in an emotional way, but representing the right kind of information, whether that's visual or written.
You're right, Chris. It is tricky. You know, I've seen some great, you know, messages outside of our category. So great messages from, I believe it was Ford Credit, you know, beautiful message, all type, just talking about, you know, no worries, you can, you know, your payments are extended, you know, for 60 days or something, but just a beautiful message. They kept talking about built, you know, built for these times, built for each other, you know, built Ford tough or whatever.
Yeah.
They had an easy way. They just wanted to talk about, hey, you don't have to pay your bill on time. Another one, McDonald's, I saw something about, you know, we're not closed, but the drive-through is open. And they just did it in a beautiful way. And we can do that, but it's a little more trickier when it comes to healthcare, because there's where we are on the front lines, living it every day.
Yeah, I saw one of the ads, one of the brands that I thought did a fantastic job, and I'm sure you guys both seen it. It was a TV spot for Sam's Club, and it was boy, I wish I could remember the name of the band. It's like a late 60s, early 70s song, "Put the Load on Me." You would recognize it if I've had "Put the Load Right on Me." And it was, who is it? I don't think it's Creedence. Is it Creedence?
Right on me.
Yeah, it's that. And so it started off by showing like a worker in the warehouse, and it said like, "Thank you, Paul Hackett." And then it showed somebody else, and it was focused on the employees. And then it showed like 3 or 4 of them in action. And then it started just scrolling names like, "Thank you, Chris in St. Louis." And there was hundreds of names, and the song's building, and the song is really somber, but uplifting. It was just really good, but you're not really paying attention to the lyrics of the song until the end. And one of the workers is loading a car, and the chorus comes up, and it says, "You took the load off you and put it right on me." And at that point, it all comes together that they're saying like, "We got this for you. We're going to take care of you." And even if, I don't even know if I would call that promotional, I guess it kind of is, but because it was focused on the workers, it didn't seem, you just got to be so careful that you're not self-aggrandizing in this, and people think you're taking advantage of a crisis to pimp yourself. And it didn't hit that at all. It was actually, with the music, really emotional.
So when it comes down to craft, and that craft of storytelling and how you balance it with copywriting and what message you're showing, and the way it's photographed or filmed. But yeah, oh, come on, Chris. Creedence Clearwater Revival. I'm younger than you. You should have got.
There's no way that's who it was. It was not CCR.
I think it is.
Tom,
No, it's
Tom,
like
someone from the
probably going like, whatever. These guys don't know what they're talking about.
someone from the
Band.
chat says it's called the band.
It's the band.
Okay.
That's right.
All right.
Come on. It was like Grand Funk Railroad or the band. Yes, that's right. I knew it wasn't CCR. Thank you, chat room, for clarifying.
But you know, that one other point I just want to make when I don't want to go off script too much. You know, prior to you know, COVID-19, whenever you're, you know, there's an ailment, you're feeling something, oh, you're not feeling too well. You go online, you go to Google, you go to WebMD, you go to these places. But when stuff gets really bad, where do you go? You run to a hospital, you know, because you know those people are going to make you better. You know, they know what they're doing. And I hate to kind of go into brand now, but just in terms of after this, when we get through this, I want hospitals and health systems to use this opportunity to be those places where people go to all the time for information, for knowledge, for help. I mean, we already go for help, but just, you know, just wanted to end with that point, because it's proving that, sorry, Chris. Yeah, we trust these people, we need these people. And I just want to see this play out over a long period of time.
I think what this is doing is this is reminding everybody the fundamental reason we have hospitals and health systems here, right? And I think, like, I'll put my hand up, right? We have a society not experienced anything like this since maybe World War II in terms of national impact. 9/11, of course, was big, but in many ways it was limited to one area. It was limited to the impact. An ongoing national thing of this nature, World War II, and you have to go back to the Spanish flu for some kind of health issue, right? And it's really reminding people, oh yeah, right. And before all of this, I think from a marketing and brand standpoint, it was like, we all know that we have to build on top of it. And so, for example, we've had conversations, I know I have personally been kind of advocating for years, stop putting doctors and nurses in your ads. It's not about you. It's about your audience. And everybody gets that there's doctors in their white coats and their stethoscopes. I think coming out of this, depending on the impact and how big it is, all of that might change.
Yeah.
The advice may be, you know what? The first thing you should do is show your doctors in lab coats. Because now we're back to kind of that fundamental place, and your brand needs to reflect that you were there the whole time. I don't know. I'm just speculating, but I think, Paul, everything we knew coming into this crisis needs to be reevaluated coming out of it.
Yeah, for sure.
Who knows how much will change, but it's that big of an impact.
Yeah.
So, all right. We have a question. Do you think we can squeeze it in? Let's try it. I haven't even read it yet. I should read it before it's too long. Here you go. Here you go, Paul. This is a softball. When you guys think about what will make great creative in this time, do you start in the healthcare industry, or do you think this is a time where we should look outside healthcare for inspiration? Is this the time to be bold?
That's a great question. And it's funny because at Revive Health, we don't think of ourselves as a great healthcare creative agency. We just think of ourselves as a great creative agency. So to answer your question briefly, yes, we don't. The bar is not other healthcare creative. The bar is great creative and great brand creative that's out there already. So yeah. Now is the time, and the time was before this as well for us.
Yeah. Yep. And I think boldness, as long as it's appropriate,
yeah,
and in the relative to the context of this whole situation. But boldness also can be more than message. It can be more than visual. It can be more than classic creative. It can be experiences. It can be a lot of different things. So for sure.
Yeah, I always say great creative is not gratuitous. It comes from a place. It comes from a strategy. It comes from what we need to communicate and say.
Right. Perfect. All right. Well, let's wrap. Perfect. If there's something you want us to cover, as always, post it in the chat before we sign off here. You can also give us feedback on our website. Again, thinkrevivehealth.com/COVID-19. That's also where you will find all of the recaps of our shows, including this one. Chase, we're going to continue to post them there so people can see the video, as well as now we are iTunes certified.
That's right. Yep.
So you can go there. Paul Hackett, thank you so much.
Thanks for having me. Appreciate it.
Fantastic. Chase, as always, thank you, sir.
Absolutely. See you tomorrow.
Bye.
Yes. Tomorrow. Well, don't leave us yet, Paul. We're not done yet. Tomorrow we're joined by Elizabeth Mussett. So Elizabeth is SVP for us in public relations. She has been studying union activity messaging because they have had a lot to say, and understandably. So how do you manage that? And we've got some other PR advice she's going to bring forward. So looking forward to that. And to the rest of you out there, keep doing what you're doing. Hang in there. We're not through the toughest part yet, unfortunately. And everything you're doing for your organization in terms of communication and for all of us is so critical. We have to have smart, effective communication to get through this. So please hang in there. We will be back tomorrow and every weekday until this all passes. So thanks for joining, and we'll see you tomorrow.